As the coronavirus hit, or I don't know how to say, was maybe the most biggest challenge, not only in Macedonia, but in the whole world. So we need to act very fast and to organize our country how we will manage all these patients. So many doctors from many specialties were included, and also in many different hospitals we opened the departments, COVID-19 centers, and for a population on for patient on hemodialysis and kidney transplant patient was at the very beginning pointed as a population at high risk for coronavirus disease. It was a great challenge also for us nephrologists to manage this patient. On this picture on the right is me and my dear colleague, Professor Jekova. We was working for 2 months in one of our COVID centers. We collect the data from the period from March 2002 and 2022. The patients with transplant kidney who were positive on PCR for test for SARS-CoV-2, all the patients with the mild, moderate, and severe form of disease. We follow up them for 1 year, and we use the standard laboratory tests. The most important for us was how the renal function of the grafts, how it will go on 1 year later after the COVID infection. So we monitor the serum creatinine, we calculate the glomerular filtration rate with the MDRD formula and CKD epi formula, and we evaluate the proteinuria, quantitative and with qualitative methods. We comparison first the results between the diseased and survivors, and then we comparison the results on the baseline before COVID-19 and on 1 year later. From a total number of 64 patients who were on the mean age of 44, 47 of them, or very high percentage of 73%, need hospitalization. And almost half of them need mechanical ventilation or oxygen support, and 10 of them need treatment with hemodialysis. 13 of the patients, or 20%, died. So when we compare this percentage with the other data, it was more or less like in the whole population. And I must say that most of our patients were at the beginning were not vaccinated because we received the vaccination a little bit later than the other countries. When we comparison the results between the diseased and survivors, results show significant difference in serum creatinine. That means that the patient who died has a higher serum creatinine. Then they have a bigger decrease in GFR. So it was obvious that the hit of COVID-19 was more on the graft function. Also, main gender means men were more prone to COVID-19 and severe form, and they were also the biggest number were also observed in the group of survivors. So when we comparison the data from the baseline laboratories values and 1 year later, we saw that the patients who were hit by COVID-19 has a significant higher serum creatinine. They have significant decrease in GFR, and also the percentage of patients who developed proteinuria was higher after 1 year. So the conclusion was that the COVID-19 has impact on graft function, but we missed in our follow-up the explanation. So we borrowed this picture from the other studies who analyzed the results from the biopsies in patients with COVID-19 with kidney transplant, native kidneys, on survivors and on patients who deceased. So the three entities pathological were as a possible damage on the kidney, acute tubular injury, which we suppose that usually will resolve, and then the others two, collapsing glomerulopathy and thrombosis, microthrombosis in glomerulus. So we suppose that these two entities usually are more obvious for the cleaning graft function. Proteinuria is always a very high marker, very good marker for kidney transplant work. So if the patient developed more proteinuria, that means that the grafts maybe will last less. So in conclusion, we must say that the COVID-19 affects the graft function, but we need further studies for 3 and 5 years later to see how these grafts will survive. And thank you for the attention.